Howdy, this is Mackenzie Scheibe,
Howdy, this is Morgan Bubley.
and this is our diagnosis within film presentation over Pete Mitchell, also known as Maverick, in the movie Top Gun. Okay, first we're going to start off with the character description. Maverick is a hotshot naval aviator and the main character in the captivating film Top Gun. The movie is mostly set at the United States Navy Fighter Weapons School, which is also known as Top Gun. The film is set in 1986 and follows Maverick's journey as he trains at the elite fighter weapons school. His environment would be described as very competitive as he's constantly competing with other highly sought after pilots. In beginning scenes of the movie, Maverick is faced with the death of his flying partner, Goose, during a training exercise where they were forced to eject from their F 14 fighter jet, causing Goose to face a fatal head and neck injury, leaving Maverick with a severe mental obstacle that he's faced with throughout the entire film.
Our diagnosis on Pete Mitchell, also known as Maverick, is PTSD, post traumatic stress disorder. What is this? It's a psychiatric condition that can exist in individuals who have experienced or seen traumatic events. These events can be inclusive of life threatening or frightening situations. What's the cultural context of Top Gun? The military environment within this movie is full of very high stress situations, and military personnel are known to be prone to developing PTSD. Other cultures, PTSD can exist in any combat or military based environment. PTSD is not only diagnosed in military personnel, as any individual experiencing traumatic events or viewing them can also encounter these adverse effects. It's not culturally specific to nations, and other cultures may view it very differently. Additionally, PTSD in specifically military culture. For this, we use the reference Jessica Chen and Molly Silvesterini, which are both award winning authors and journalists, and the other one being a research specialist. PTSD in military culture is often hidden as it's shown as a sign of weakness. These authors describe this as male veterans face additional stigmas seeking mental health care due to traditional masculine ideologies perpetuated by military culture. Evidence for these symptoms that in PTSD are symptom one, which is displayed in this film, is Pete Mitchell or Maverick's intrusive memories. For example, in the film following Goose's tragic death, Maverick is frightened to fly again as he often receives flashback memories. These are known as a flashback trigger response. During the flashback triggers, Maverick experiences heavy breathing and shortness of breath. Our second symptom, also displayed in the film, is survivor's guilt. Before a flight mission, Maverick talks to a fellow aviator known as Viper regarding his belief that Goose's death was his own fault and how he should have been the one to pass away. Our third symptom, not displayed in the film, is the inability to feel any positive emotions. Once again, this is one Maverick did not experience. In the film, during Maverick's struggles to overcome his guilt and grief, he still manages to develop new friendships and even has a girlfriend named Charlie, overall verifying Maverick's ability to still feel the positive emotions. A reference for this is Richard Bryant, who's an esteemed psychology professor, and he in his article describes PTSD under the classification of being DSM 5. A short paraphrase from his article is in addition to symptoms of PTSD, including distressing memories, dissociative reactions, negative mindsets, and flashbacks. All of these show the symptoms described.
Okay, and now we're going to discuss a treatment plan for Maverick. And we decided that he would be best at the most effective treatment would be cognitive processing therapy. So as a treatment plan for Maverick after diagnosing him with PTSD, post traumatic stress disorder, we would recommend a treatment plan that consists of the cognitive behavioral therapy, specifically cognitive processing therapy, as it helps patients learn how to modify and challenge unhelpful beliefs related to their trauma. As for Maverick, it would challenge his trauma relating to the death of Goose. This treatment is appropriate for this disorder as it is commonly used for both people in active duty and veterans. This plan consists of a 60-minute session twice a week over the course of around 6 weeks. It would force Maverick to talk about the event that took place, as well as modify him into believing that the accident was truly not his fault. The authors of Effective Group versus Individual Cognitive Processing Therapy in Active Duty Military Seeking Treatment for Post-Traumatic Stress Disorder describe the effectiveness of this treatment by providing results from studies using active duty military, effective group versus individual, as both are seen as positive outcomes. It just depends on what works for every specific patient. Some ethical concerns from the use of this treatment may consist over the fact that we do not truly know everything about Maverick, more specifically, all of his childhood, which may play a factor of his diagnosis. Another thing that may hinder the outcome of this therapy is that it is based on interactive communication with the professional. We cannot force Maverick to show up to these sessions, which could negatively affect his improvement depending on his choice of showing up to face his trauma. Okay, in broader perspectives, the portrayal of PTSD in the movie of Top Gun does represent an accurate demonstration of the adverse effects the psychological disorder has on individuals who have experienced traumatic events. The accuracy of this disorder is proven through scenes displaying PTSD symptoms. The movie demonstrates how the U.S. military is known to handle trauma. PTSD being displayed in this movie encouraged to open the conversation of how nobody is perfect, whether you wear camo or plain clothes. And traumatic events can have a significant impact on an individual's health.
Here's our citation page of all the references we used.
And pictures.
Thank you.
Thank you.